Well, thank you for joining us today. I'm joined by, of course, our PC Health Critic, MPP Jeff Yurek, Tara Bork, doctors Nadia Lam, Mark Linder, Jason Profetto, Kulvinder Gill, and Brenna Velker. The Ontario Liberal government continues to make short-sighted decisions affecting our most vulnerable in Ontario. They have cut the healthcare spending, $54 million in 2015, in terms of the transfer that the federal government gave the province. We've seen a $50 million cut in physiotherapy, over $800 million in physician service fees. Meanwhile, over 800,000 people in the province are without a family doctor, and an additional 140,000 new patients are coming into the system each year. All of these cuts have one common denominator. They hurt patients. This is what it's about. It's hurting patients. As I've traveled the province, I have visited hospitals, talked to doctors, talked to patients, whether it is in Ottawa or London or in Windsor. It is a common theme in every community we go to. People are concerned about the diminishment of healthcare in Ontario. We deserve a government that makes patient-centered care a priority. Wait times for life-changing surgeries, doctor appointments, and emergency room visits continue to get longer. People in remote and northern communities are forced to travel longer distances to access the services they need. When I meet with doctors, I hear how cuts are impacting their ability to provide a level of patient care they aspire to. 241 communities in Ontario are designated as having high physician needs, yet the government continues to cut medical residency positions. Other doctors and former colleagues decided to move to other jurisdictions to practice. Just last week or 2 weeks ago, I brought up the point of this happening in Thunder Bay, leaving more Ontarians without a doctor. When I meet with nurses, I hear how nursing colleagues were laid off, how their already hectic patient loads are getting even more hectic. They struggle to keep up, but sadly continue to see further reductions to important face time with those they care for. Mismanagement in healthcare is affecting patients. These cuts to frontline services are a blatant attempt by the governing Liberals to clean up their own fiscal mess. Providing necessary physiotherapy for seniors or physician services in general did not cause our debt or deficit. It was years of scandal, waste, and economic mismanagement. The reality is this Liberal government's record of economic mismanagement has meant less money available for healthcare services Ontarians need. Patients suffer when the money that should be used for healthcare is swallowed by bureaucracy, scandal, and incompetence. And blaming the federal government doesn't wash with the facts. Federal contributions since 2004 have gone up 6% through the Canada Health Transfer. So quite frankly, there is no one left to blame for this epic failure than the Liberal government themselves. Today you will hear from both doctors and patients who have first-hand experiences with the consequences from these ill-conceived cuts. What's important to take from this is not that the Liberals have cut millions here and there, but that patient care in Ontario is suffering. And the only one to blame is the mismanagement of this government, of Health Minister Eric Hoskins and Premier Kathleen Wynne. So on that note, I'm going to ask Jeff Yurek, our health critic, to add a few additional points before we hear from some of our professional representatives here today.
Thanks very much, Patrick, and thank you for coming out today. We're here today with family doctors and a patient who will share their stories from you. And they've come from around the province. They're not just Toronto-based. We have them from Sarnia, from London, Stony Creek, Brampton. So we're glad that they've come to hear their stories. And just to say, healthcare is the provincial government's most responsibility to deliver to people today. Our health and our health of our families are very important to us, and we depend on reliable and timely access to quality care. Unfortunately, this government continues to erode the already fragile system we have in place. This is a government that continues to punish patients and frontline healthcare workers because they're spending the money on Liberal scandal and mismanagement. Our caucus is pleased to put forward an opposition motion today to restore funding to physician services and return the missing federal Canada Health Transfer money back to Ontario's healthcare system. Our Ontario patients deserve better. And I'd like to bring forward a patient, Tara Bork, who will tell her story, followed by Dr. Nadia Lam, Dr. Mark Linder, Dr. Jason Profetto, Dr. Kulvinder Gill, and Dr. Brenna Velker. And each one bring a telling story of how these cuts this Liberal government has imposed on our healthcare system is affecting patient care throughout Ontario. Tara?
Having been born with cystic fibrosis, a genetic disorder that impacts your lungs and digestive system, I'm no stranger to our healthcare system. From routine clinic appointments to drug trials to hospitalizations, I've gotten to know the ins and outs of our healthcare system from both a patient's perspective as well as a healthcare provider's. 4.5 years ago, at the age of 17, my health was plummeting and my life was put in the hands of Ontario healthcare workers. I was living off of oxygen 24/7, I was breathing with a BiPAP, I was attempting to ward off any further infection with IV medications, and the hospital had become my home away from home. At this point in time, my healthcare team in London had transferred me over to the St. Michael's Hospital in Toronto, who took care of me and prepared me for my wait for a double lung transplant. I fortunately waited only 11 days for new lungs, and then my new team of doctors at Toronto General Hospital took over as my primary caregivers. Had it not been for the doctors and nurses that came running every time I rang a call bell, who listened to my dad when he suggested I was having an allergic reaction to IV lipids and not a medication, who helped me shower when I was unable to, who brushed my hair and brought me treats to make me feel better, I would not have survived the year of inpatient stays that I had leading up to my new lungs. Had it not been for the respiratory technicians, the dietitians, the physiotherapists, and the social workers who came in to work with me on a daily basis, who built relationships with me, and who ensured that they were doing everything they possibly could to make sure that I was feeling good, I would not be here today. This summer, I was able to hike a mountain in Banff. All of this would not have been possible without the doctors, nurses, and my entire healthcare team here in Ontario, who promised me I would make it to receive my transplant. They worked holidays, weekends, answered any texts, phone calls, and emails I sent, and they made their lives revolve around myself and my health. They created relationships with me that I will always cherish, asking about my school, my friends, and my family. They didn't treat me as a number or as an unknown patient that they just had to treat and briefly move on. They cared about me, and that's what makes our healthcare so special. With cuts being made to our current healthcare system, it is putting a strain on the workers who are already stretched far and few between numerous patients. This makes doing their basic job of administering medication and treating patients more difficult and stressful, and they are unable to create the special bonds like the ones I have experienced. There's so much more to quality healthcare than just going about the motions and moving on to your next patient. With my lungs being in chronic rejection currently, I will require another double lung transplant in the near future. I hope to be able to experience the same high quality of care that I have been blessed with for the past 22 years of my life. There's a physical part of having a chronic illness, but there is also a mental aspect. If cuts continue and we continue to lose Ontario doctors, I worry that the personal aspect of care will be diminishing. I worry that the next time I'm an inpatient, there won't be someone available to take the time out of their day to come and comfort me and listen to my troubles. Chronic illness takes a toll on your mindset, and we really rely on our relationships that we form with our caretakers to build trust in our care and bring hope for a cure or control for our disease. 4 years ago, I was told I was dying, and today I'm 22, still kicking, thanks to my healthcare team here in Ontario.
Good morning. January 2015, negotiations between the OMA and the Ministry of Health broke down. With a single-minded focus on balancing a budget, the Liberals refused to consider any option other than sweeping cuts to funding patient care services. They refused to apply all of the federal health transfer towards provincial health care. They refused to pay their share of natural growth in healthcare demand. And finally, they put a limit, an actual limit, and force Ontario physicians to ration patient services. October 2015. Ontario's physicians have watched appalled as the ministry imposes cut after cut. Over and over, physicians warned the ministry the consequences will be severe. Targeting physicians will not fix fiscal blunders. In the end, the true victims will be our patients. The last round of cuts on October 1st brought many physicians to their breaking point. In the past 3 weeks, 7 family doctors have closed their practices across Ontario. Patients affected, 10,000. 8 family doctors are prohibited from opening new clinics. Patients affected, 8,000. Several specialty clinics, dermatology, orthopedics, ophthalmology, nephrology, cardiology, and addiction medicine, can no longer serve their patients because they have to close their doors. These patients will be transferred to the local hospital where care is more expensive and the wait times are longer. 2 community INR clinics have shut down, 15,000 patients affected. 2 community flu shot clinics have shut down, 20,000 patients affected. Staff, including secretaries, clerks, and nurses, all laid off. Many physicians are scrambling to keep their clinics running and seriously wondering how much more they can take. Morale is low. This is happening all across Ontario in large cities and small communities. This is happening in my community. Winter approaches and the cold weather brings with it the usual illnesses. I'm not talking about colds here. I'm talking about the nasty bugs that cause illnesses like the flu. I work as a small-town GP anesthesiologist. I've assisted in many emergency resuscitations of people deathly ill with the flu. Every single one is etched in my mind. The frail 73-year-old woman from the local retirement home approaching her 50th wedding anniversary who dies from influenza pneumonia. The 2-hour struggle to bring back the 45-year-old man who still dies from influenza pneumonia, leaving behind a pregnant wife and 2 young children. The 6-year-old child suffocating from an out-of-control asthma attack because of the flu. Our best defense? The flu shot. But because of Eric Hoskins' cuts, flu shot clinics are now too expensive for family physicians to run. So more people will have to go to pharmacies and public health agencies, which ironically are more expensive for the government to fund. These cuts are not cost effective. These cuts are reckless and short-sighted. These cuts hurt patients.
Thanks very much for being here. One brief thing that I'd like to bring up that I'm not sure that the public and the media are terribly aware of is that above and beyond these cuts that we're talking about, which have been imposed since January and amount to almost $1 billion, is that the government has also imposed a hard cap on the budget they use to pay for patient visits. If they hit their budget before the end of this fiscal year, which they very likely will, the government have said they will stop paying for patients' health care. This is unconscionable. I have a 7-month-old baby girl who is going to be seeing her pediatrician several times over the next year for vaccinations and, God forbid, if she gets sick. I have an expectation that the government will pay for these visits. I think we all feel that way. That's what universal health care means. Certainly that is an expectation of all my patients, both in my family medicine group, as well as in the emergency room. And it's my expectation as a father, as a husband, and as a son of elderly parents. Just to be clear, the hard cap goes much farther than this. It extends to the funding of joint replacement surgeries and other medically necessary operations, visits to the cancer doctor, the endocrinologist, the neurologist for stroke victims, all of the patient care that the citizens of Ontario require. Even more disturbing is from this same pool of money that money is drawn for disaster preparedness, like SARS. It's our government's duty to properly fund our healthcare system, and they are deliberately and recklessly shirking that duty. Thank you.
I bring to you a very real story from my practice. I'm a family doctor in Stony Creek, and a pleasant elderly gentleman came to see me months ago because of severe right knee pain. With a simple x-ray and getting the story and doing a physical exam, we determined that he has end-stage arthritis, severe joint degeneration. He has a lot of pain and he's suffering with it. It's affecting his ability to walk and do simple things around his home. Within 12 hours of seeing me, we do a referral to an orthopedic surgeon because both the patient and myself agree that the best next logical step for him is an actual joint replacement of his knee. 3 months after we make the referral, we receive the appointment time. The appointment is for 6 months after him and I actually have this discussion and I made the referral. This is because of direct cuts from Eric Hoskins. After he sees the orthopedic surgeon 6 months after he initially saw me, he has to go on a wait list of 9 to 12 months before he actually gets a joint replacement. In that entire period of waiting, he is suffering with pain, immobility, and difficulty doing things around his own home. These are effects directly from cuts from Eric Hoskins. This is not a problem with the hospital. It's underfunding to the hospital. We have operating rooms that are open. We have excellent colleagues, orthopedic surgeons that are on standby, ready to actually operate and replace these knees. These orthopedic surgeons, colleagues and friends of mine, are going south of the border. They're leaving Ontario. And as a result, my patient, this pleasant man with end-stage arthritis, is suffering. This is not a rare story. In my practice alone, I see this approximately 2 to 3 times per week, if not more. Patients are actually suffering.
My mom had become a palliative care patient after a long and courageous battle with breast cancer. I was in medical school at the time, and my family was fortunate and blessed to be living in Manitoba, a province that has been a pioneer in palliative care. My mom had access to some of our country's best doctors and nurses through their home and hospital-based programs. During the last 4 months of her life, her doctors made daily home visits to ensure that she was dying comfortably. Palliative care provides emotional and physical support along with comfort to patients and their families during the final stage of their lives. And yet, it is these dying patients that WIN's government has chosen to neglect. Palliative care in Ontario is largely provided by family doctors. Several communities are no longer able to attract new family doctors because the ministry has declared them as not underserviced. St. Joseph's Health Centre Family Medicine Department right here in Toronto used to provide home and inpatient palliative services, but they have been forced to terminate their program, and they, due to chronically understaffed ward and the demand that has been overwhelming. In communities across the province, there is a wait list for palliative care house calls. Just in the community of Etobicoke Lakeshore alone this week, there are currently 3 patients dying at home. Dying at home without any access to a palliative care doctor. Dying at home without any management of their pain and suffering. The Canadian Medical Association has mandated end-of-life care as a national priority. And yet it is our province here in Ontario that is leaving these dying patients without the support that they need. Despite their wishes, patients are unable to choose to die at home under the care of their doctor. A patient shared with me recently that her husband, a palliative cancer patient, had died in the local ER because there was nowhere else for him to receive palliative care. These patients deserve to die with dignity and with respect. These patients are someone's mother, someone's father, and someone's child. They deserve to die as my mother did, surrounded by their loved ones, knowing that their doctors will be there to ensure that they die comfortably. Why is the Liberal government turning their backs on some of the most vulnerable patients in our province? These unethical and immoral cuts must stop now.
As you have heard, not only has the reckless and disorganized approach that the Wynne government has taken with healthcare in recent months significantly affected patient care today, but these changes will no doubt have long-term effects. I'm a resident doctor in my last year of training in family medicine, and I'm quite concerned about the future of family medicine in Ontario. In collaboration with family medicine resident councils across the province, with input from a number of other provincial organizations, I asked family medicine residents about their plans for practice after they graduate, and how these plans may have changed as a result of the careless changes being made by the Wynne government. We collected input from family medicine residents all across Ontario. At the start of their training, which was 1 or 2 years ago, 90% of them, 90%, planned to stay and practice in Ontario. Now, only 33% plan to stay. 50% are unsure, and nearly 20% say they will leave. These numbers are consistent across training programs, across age, and across gender. Looking at the data for first-year residents only is even more concerning. Only 25% say they will stay in Ontario. It's not only residents who are originally from outside the province who came here to do their training who are planning to leave. The Wynne government has created a situation where those born, raised, and trained here with significant ties to the province are seriously considering or are planning to leave. They have cut the number of residency training spots in the coming years. There are at least 800,000 patients in Ontario currently without a family doctor, and 140,000 new patients enter our system every year. We know that strong primary care is the foundation for a healthy population, but the Wynne government's haphazard approach will do exactly the opposite. Less spots to train family doctors, and after graduation, more and more of them will leave the province. It's a recipe for disaster, and patients and their doctors need to come together. Patient care is being affected today, as you've heard, and if something isn't done, it's only going to get worse.
These are very specific examples of the impact of healthcare cuts since October 1st on patient care in Ontario. We encourage all of you to visit our public Facebook page, We Are Your Ontario Doctors, to read more stories about the impact of these healthcare cuts on doctors, healthcare workers, and patients from across the province.
So we'd be happy to take any questions for any of our speakers today.
Did you say there's a hard cap on the number of visits that patients can make, or the number of patients that the doctors can see? How does that, can you explain a little how that hard cap that you were talking about works?
Yeah, I'll do my best to try and explain that. It's a bit bizarre, but that's essentially what's been declared, is that as soon as there's a certain budget that's being used to pay for patient visits, as is always the case, and the new thing that Eric Hoskins and the Liberal government have said is that when we hit the cap, when we hit a certain figure that they've predetermined, which is not really based on anything realistic, they will from then forth no longer pay for patient visits.
What is that cap?
What is it set at? I think I know it's 1 point... Oh, you got that?
We don't actually know. The truth is that we have no idea when we will hit this limit. But at some point, the government's going to turn to us and say, we have no more money to pay for these patient care visits that you are providing.
So how do you foresee that will play out? I mean, if my doctors, can't take any more patients, or can't get paid for taking any more patients, does she have to kind of eat that, or does she just say, no, I'm sorry, I can't see you, I've reached the limit?
That is exactly how it will happen.
Yeah.
The payment will be taken from us retroactively.
For those doctors who continue to see patients. But I mean, I think that question is probably best addressed to Dr. Hoskins. He is fully aware of it. He knows that that's what the case is. He knows that they will hit the budget. So I would put it to you to put it to Dr. Hoskins and say, what do you expect is going to happen here? I mean, if you're not going to pay for any further patient visits, what do you expect to happen?
And I would add in that the government's only response, again, we've obviously raised this a number of times at Queen's Park, their only response is that, doctors over their tenure in government, salaries have gone up 61%, and that's very misleading. The reality is there's a lot more doctors in the system, there's a lot more patients in the system. With the growth of 140,000 patients a year in Ontario, we're a growing province, and the notion that you'd cut education because there's more teachers, or you'd cut the funding for the legislature because there's going to be more MPPs in 2018 would never happen. So the fact that it's happening here in healthcare, in our opinion, is unacceptable. The other government response has been, well, doctors are very highly paid, and the stat they keep on using is that doctors make $350,000. What that misrepresents is the fact that doesn't include overhead. And as I've traveled the province, I have heard doctors tell me stories where their overhead is 40%, or in some cases even high as 60%. Doctors hire additional healthcare workers to serve a broader patient base. And so I think the government's being insincere with their responses, and we're trying through the stories of doctors and highlighting this across the province that this is affecting patient care.
What about the argument that the healthcare system is trying to shift resources into community, into home care, into home visits, and that's why they're putting sort of a squeeze on sort of the traditional healthcare budgets?
Well, I'll let Nadia speak to that as well, but I just say call a spade a spade. This is an $800 million cut, and the government will use spin to say this is to shift this or shift that. They're cutting 50 residency spots, and the response was, oh, we want to, shift doctor care to different parts of the province. They're cutting 50 residency spots. There'll be less doctors. When they say that they want to shift medical services, it's still an $800 million cut in a year. There's no way to change the argument that they're spending less on healthcare than they were given with the federal transfer. It is a cut to healthcare, and they have to explain to families in Ontario why they're cutting healthcare. Why is that their priority, or where are their priorities?
Il y a quand même la question, parmi les trois choses dont le coût augmente le plus rapidement en santé, il y a les salaires des médecins. Est-ce que c'est pas une question quand même importante, ça? Si on parle, une famille moyenne au Canada fait 63 000 quand les gens entendent qu'un salaire peut aller jusqu'à 800 000 par exemple, dans certains cas, est-ce qu'il n'y a pas une question quand même importante pour les Ontariens?
I'll respond to that question, but then we'll give Nadia a response to respond to the previous question. Il y a un prix avec la santé dans l'Ontario, et c'est d'habitude c'est quelque chose. Si tu veux voir l'excellence dans la santé, qu'il y a un prix avec la santé pour les médecins. Maintenant, ma question est pourquoi est-ce que ce gouvernement coupe la santé? Où est les priorités pour ce gouvernement? Et ça, c'est maintenant une solution pour leur erreur. C'est une solution pour le scandale et un gouvernement qui gaspille l'argent dans les différents enjeux. Il gaspille l'argent sur le gas plant pour smart meters. Ontario, chaque mois, il y a un nouveau scandale, et je pense que c'est important pour le gouvernement de dire qu'il y a des priorités très importantes pour la province. Et c'est l'éducation, c'est la santé, et maintenant, c'est un fact dans Ontario qu'il coupait la santé. Il coupait le transfert du gouvernement fédéral, et ça, c'est quelque chose que notre médecin a besoin. Ça, c'est quelque chose que notre système de santé a besoin. But I'll let Nadia respond to the previous question.
This is about the question about CCAC funding. I want to make clear, Ontario physicians work tirelessly to help patients from the very young to the very old. Eric Hoskins' comments are divisive, and they're distracting from the real issue at hand. He is trying to pit physicians against community agencies, and that is not fair. We demand that the Ontario Liberals collaborate with physicians, nurses, community agencies, and patients, all of the people actually invested in the healthcare system, to come up with a fair, sustainable, and inclusive solution for everyone without distinction.